Hey guys, just thought I'd make a quick podcast explaining geographic location and how it affects access to health services. So to start off with, there are three different ways to define non-metropolitan areas in Australia. So the classification is, the first one, the Australian Standard Geographical Classification, which measures urbanness and ruralness. There's then the Accessibility/Remoteness Index of Australia, which measures level of accessibility to goods and services. And finally, there's the Rural, Remote and Metropolitan Areas Classification. So those three combined in order to determine what the area is classified as. As the distance from major cities and regional areas increases, the level of access, disease risk factors and prevalence of illnesses increase. Okay, so remote Australia covers about 85% of the Australian landmass. Remote areas can include towns such as Broome, Broken Hill, Alice Springs and Mount Isa. Generally speaking, remote communities are small and services may be limited or not available at all. Many of Australia's islands are also classed as remote. In some situations, travel to major cities can be difficult or impossible at certain times of the year due to wet weather. Access to a variety of foods, such as fruit and vegetables in particular, can be limited. This is due to the higher cost of transportation and the lack of appropriate storage facilities in these communities. 1/3 of Australian population lives in rural and remote areas. These Australians face unique challenges as a result of their geographic isolation, which frequently leads to poorer health and well-being outcomes compared to those living in major cities. Limited access to health services is a major problem for those living in rural and remote areas within Australia. Key factors relating to this issue include an inadequate supply of both hospital and other health services, and workforce shortages in these areas. So the issues relating to geographical location in regards to accessing healthcare. So there's a lower number of doctors, specialists and hospitals, reduced availability of technology for diagnosis and treatment, slower emergency treatment due to the distance, and preventative health measures such as access to cancer screening is difficult to access due to needing to travel to the city or large hospitals. The barriers for accessing health services include needing to travel long distances, missing work or school commitments, time away from family and friends, the stress of travelling large distances, and the ability to reach cities due to weather conditions blocking road access. The Royal Flying Doctor Service, so they're an organisation which provides emergency and primary health services for Australians living in rural, regional and remote areas. They cover an area of 7.69 million square kilometres and aim to improve health outcomes and save lives. Understanding the issues associated with accessing health services for those living in regional, rural and remote areas, the Royal Flying Doctor Service are trying to work towards improving access through their service. Even with this service, treatment for emergencies is still slower compared to those living in major cities with access to ambulances and hospitals close by. So some data collected by the AIHW 2018 in relation to remoteness. So experiences with GPs care vary by remoteness. In 2016 and 2017, 21% of people in outer regional, remote, very remote areas waited longer than they felt was acceptable to get an appointment with a GP. That's compared to 19% in inner regional areas and 18% in major cities. 33% of people in outer regional, remote, very remote areas reported they could not see their preferred GP on one or more occasions, compared to 28% in inner regions and 25% in major cities.